March 2020 to November of 2021, 20 months of life-altering changes and loss.
For most people sick with COVID-19, symptoms last up to 2 weeks, but for others, the impacts linger.
WFMY News 2's Megan Malaris met several survivors of what's called long-haul COVID, working through pain to persevere.
These last 20 months, Deborah Williams has walked a long road.
It's just hard.
Her steps are slower these days, anchored by an aching body, mind, and spirit.
I just want people to know this COVID does not discriminate. It is no respect of persons.
Her beloved husband, James Williams, was a nationally acclaimed musician. Their special song, Color Him Father, wrote the track to their 20-year relationship. Until one day, without warning, the song stopped.
I got a phone call at about 8:45 saying, Mr. Williams woke up coughing real bad this morning, so we sent him to the hospital. 45 minutes later, the doctor called me and told me he's dead.
His widow was in the gutters of grief when in April, just shy of getting her COVID vaccine, she contracted the virus.
You want to die, you hurt so bad.
And half a year later, she still wears her wounds.
I lost my hair, just handfuls and handfuls of my hair, and I haven't been able to walk right. I can only get shoes on like this. My leg has been swollen and they don't know why. There's no reason for it to be other than COVID.
She's not alone. Research shows more than 2/3 of people hospitalized with COVID-19 have at least one lingering symptom 6 months after discharge. The experience is so common it now has a name, long-haul COVID.
Normally you should get over COVID after 2-3 weeks. After 8 weeks, you are still having some symptoms, then you are classified as long-haul.
Cone Health Community Care Director Olu Jegede has noticed long-haul COVID affects far more women than men.
It looks like they have more of the immune system fighting themselves.
And the numerous side effects range from mild to severe.
The one that is very disturbing for our patients is the brain fog. They can't remember things. They find it difficult to find their words.
Each experience, each route on the long journey is unique. Carol Hardister contracted COVID nearly a year ago.
I can tell you I probably have maybe 5% of my taste and maybe 3% of my smell. I'm a huge cook. I love to grill out. I love to eat. So now after I've had that, it's really been taken away from me.
Barbara Curtis can empathize. She's on the long road too.
Before I had COVID, I done a lot of things. I was active. I done ballroom dancing. I went to church.
Curtis was the last patient discharged from Cone Health's COVID-only hospital in March.
There you go. I'm happy. Yeah.
Despite huge strides, she still deals with chronic fatigue.
Some days when I come home, I have no energy to do anything else.
Long COVID really don't have treatment per se. So it's just kind of managing the symptoms of the patients.
That's why Dr. Jegede and nurse practitioner Tanya Nichols run Cone Health's post-COVID clinic in Greensboro, the first of its kind in the area.
If you could just take some deep breaths for me.
Since it opened in March, 500 long haulers have sought help here.
When I went to the beautician, they thought I had cancer, but I said no, it was from COVID.
Long haulers like Anita Johnson get evaluated and monitored at the clinic, then referred out to specialized care, from physical therapy to pulmonary support to, perhaps most importantly, mental health counseling.
They are just grateful, a lot of times just to have somebody to talk to about it, somebody to validate their feelings and just know that they can get help.
And to feel a sense of purpose, not as sufferers, but survivors.
Sometimes it get hard. Some days it be very, very hard. But I just ask for strength, ask God to give me strength, and he does that.
And for Williams, strength comes in taking a stand to advocate vaccines.
I had to tell my grandkids, you know, if y'all not gonna get vaccinated, you gotta stay away from me. And that's hard because I can't see my babies.
Yet when she feels lonely and out of sync, she turns to her late husband for help.
He would always tell me that If he died before me, if there was any way in the world he could send a sign to me from heaven, he would. And so when I was getting ready to bring this stuff out to you, I went in the house, I had the radio on, and Color Him Father was playing. It's like he knows we're doing this interview, and he's here in spirit.
A reminder, love is in it for the long haul too, and no one has to walk the long road post-COVID alone. In Greensboro, Megan Malaris, WFMY News 2.
There still isn't a cure for long-haul COVID. Doctors say the vaccine helps. Some side effects actually improve after taking it. Others can find relief at Cone Health's post-COVID clinic. It is now taking patients. Find more information on our website.